the talking door.
Welcome back. Today on Ask the Expert, he is a pediatric cardiologist. Is so glad to have Dr. Jeffrey Moore with us from Toledo Children's, joining us with the answers to some of your questions. Doctor, good to see you. Our first caller said, my teenager complains that he's dizzy and lightheaded all the time. I remember feeling this way as a teenager as well. Should I tell him it's normal and then he'll just grow out of it? What do you say?
Yeah, well, thanks for having me. Dizziness and lightheadedness, especially with things like position changes, prolonged standing in sports, are relatively common in the teenage years. Teenagers are often unaware of how much fluid and salt they need, and particularly when they hit their pubertal growth spurt. And all of a sudden, they're in a bigger body. Teenagers really should try and balance their water and electrolyte fluid intake, usually at about a 50-50 ratio. You know, I really like things like milk, whether that's cow's milk, soy milk, almond milk, because of the electrolyte content. You know, sports drinks are okay, but I really recommend staying away from the sugary sports drinks. So I like the lower calorie or preferably the 0-calorie options.
Okay, our next caller wanted to know from you, doctor. Say, I continue to see people discuss online that vaccinations are not safe. I vaccinate my children, but now I'm starting to wonder, should I do it or shouldn't I? What do you think?
Good question. So the safety and effectiveness of vaccines is one of the most scientifically proven things we have in the medical industry. Vaccines have eradicated some of the most devastating diseases which we have seen over the last 100 years, which unfortunately are starting to reappear in unvaccinated populations. I strongly encourage you to talk to your doctor about the safety and importance of vaccines.
All right, Dr. Jeffrey Moore joining us once again. My husband, this caller says, is a terrible snorer. I keep telling him to go to see a doctor about it, but he won't. Are there any long-term health issues with this?
Yeah, so snoring can be a sign of what's called obstructive sleep apnea, which can cause long-term health issues. You know, I would recommend that your husband see a sleep medicine doctor who will ask a series of questions and might determine what you might need what's called a sleep study. You know, sleep is important to overall health, and sleep apnea can cause things like fatigue, daytime drowsiness, high blood pressure, higher blood sugars, and can increase your risk of things like arrhythmia, heart attack, and stroke, just to name a few. All
right, good advice as always. Doctor, good to see you. Thank you so much for being a part of Ask the Expert today.
Yeah, thanks for having me.
You bet. Coming up tomorrow on Ask the Expert, legal advice, free legal advice. An attorney will be here in our studio. If you want to send us a question ahead of time, news@13abc.com is the place to go. Well, to make it